Hello and welcome to the Beyond Borders podcast. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with Mr. Willy Pedroso. He's joining us here as operations manager for SixEleven. Welcome to Beyond Borders, Willy. Thank you so much for joining us.
Hi, Neil. It's actually a pleasure for me joining with you. So I'm excited actually prior to this interview.
Great. Well, excitement is what we're about. When it comes to outsourcing, tell us a bit about yourself and how you came to be involved in outsourcing.
Well, it was actually 12 years ago when I started in outsourcing and specifically with SixEleven. So I've been with the company for 12 years now. And actually, I started as a web developer and graphics artist before I handled medical accounts in the company. So you're wondering maybe that why was I working in the medical stuffs or medical field? So again, I was an IT by profession, but it was through time that I developed and learned a lot of skills in the company, especially in outsourcing, wherein I learned from technical stuffs to medical stuffs, wherein now I'm handling most of the accounts in SixEleven who are working with, of course, medical institutions in the US. And not only in the US, but also we have companies who are working with in Europe and also in Southeast Asia and Australia.
How does working in the medical field differ from outsourcing in other fields, say finance or call center?
Well, when it comes to actually medical field, it's more of us engaging their patients. This time it's more of patients rather than clients. So what our agents are doing like on a daily basis is more of contacting these clients or receiving calls coming from these patients wherein they do appointment scheduling and sometimes billing. And also we have we are also verifying their insurance as well. So it's more of us working with patients rather than working with clients.
So each of your agents has to be specialized in many disciplines, or does each agent specialize in one or maybe two?
It's actually a combination of agents who have experience when it comes to medical stuffs and those agents who are experienced with customer service. So, because we are sometimes required by our clients to like, have this agent be is experienced one when it comes to customer service, billing, or sometimes with background when it comes to medical, so they can understand those terms that our patients are saying through call or through chats.
So basically, you have to have a wide knowledge of all of the medical terminology, as you said, in order to be an effective agent. So you're not really doing any hands-on medical work, just to be clear.
Yes, a support. So it's more of like us doing a training to them or with them actually prior to onboarding, because of course it takes a lot of training time and familiarization when it comes to terminologies that they are using, especially in the medical field. So whenever they, for example, if they ask like for a customer service, who will be handling their inbound and outbound calls? So this specific agent should know also the basic terminologies that they are using in the office. So it would be, I guess, easier for them to understand what the customer or the patient is trying to say over the phone.
What other types of support roles does SixEleven offer when it comes to the medical field? You're talking about incoming and outgoing calls. What other types of support do you lend to the medical community?
Well, most of the support that we are actually lending or giving to our clients are mostly on customer service. So these agents are receiving calls or either doing outbound calls to our patients. So it's more of us doing the calls to them when it comes to, for example, if they would like to be scheduled for an appointment for a doctor or when it comes to billing. So we are also, again, doing both inbound and outbound calls for them. We are also dealing with insurance verifier wherein our clients are related to in. So when it comes to insurance verifying, our agents are doing calls just to verify to the third party companies their insurance, of course, so we can proceed with the billing and so on.
How do the two languages, say the medical language and the insurance language, interact, and how easy is it to flow from one to the other in your role as support?
To tell you honestly, it's somehow difficult and a bit challenging at first.
Mhm.
But when you get used to it, when it comes to the terminologies that they are using, it's actually easier. So I guess it would be, more of the muscle memory on our agents when they deal with our patients.
As far as the high turnover in the medical community that we've been seeing over the past several years, how does that affect outsourcing? How does that affect your ability to be effective for your client?
Well, we do upgrade actually when it comes to dealing with our clients and patients. So for us to be upgraded, we also do calls with our clients wherein we do calibration calls with our clients to align everything. So whenever they have new updates or maybe new learnings or knowledge that they would like to share to our agents, we do that once a week or on a daily huddle before we start with our work. So both of us here and our clients would be aligned.
It's my understanding that the culture of outsourcing there in the Philippines is quite robust and exciting, for lack of a better term. Is it a bit more difficult to find people, although they may be excited to, work outsourcing in other countries? Is there some hesitance when it comes to being assigned to a medical client?
Sometimes, yes, but most of the time we have a lot of agents who are also willing to learn and new knowledge actually, especially when it comes to medical field. Because as you all know, or in a typical Filipino culture, what we know about call center is just merely calling, right? So it's more of a new task for us when we learn about medical stuffs. It's a bit challenging at first, but it's again a muscle memory for the agents when they actually work on that field, specifically on the terminologies and how they handle these patients.
Summarize for us the benefits that 611 can offer to its clients, and then give us some contact information where our listeners can get in touch with you and better understand those benefits.
Sure, Neil. So with 611, we are actually HIPAA compliant. That means that we are accredited when it comes to working with medical organizations in the US. We have highly skilled agents who are also working on different fields. We have a lot of experience when it comes to dealing with different customers. We have different projects, not only with specific field and medical. So we are dealing with pharmaceuticals, pediatric care, with dental accounts. So it's more of us gaining a lot of knowledge when it comes to these type of industry. And it's a good thing that we have a lot of trusted clients who are also referring to other clients. And this based, of course, with their experience with us. And it's a big thing actually that we have a lot of Filipinos who are also working in medical field in the US and in abroad who can refer Philippines or Filipino itself who are good when it comes to dealing with patients and the care that we give. So when it comes to that one, we can provide that one with 611. We know better than anyone else, I guess, when it comes to dealing with patients, as we have experience, vast experience, to be exact, when it comes to dealing and, of course, making sure that our patients and clients are happy. You can actually contact us at 611bpo.com.
Willy, it's been a pleasure. Thank you so much for joining us here on Beyond Borders. And I'm hoping that we'll get an opportunity to talk again. You can tell us more about 611 and the support that you offer to the medical community. Thank you so much for joining us.
Thank you so much, Neil. It's a pleasure for me too.
You've been listening to the Beyond Borders podcast. I'm your host, Neil Howard, speaking with Willy Pedroso, Operations Manager at 611. Find out more at verticalinternetmedia.com and find out more about our outsourcing services at outsourcingfit.com.